Good morning and welcome to Health Matters at the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. It's hard to believe we are celebrating the 10th anniversary of the Health Matters radio program. We're planning some special shows to celebrate the milestone, so we hope you will stay tuned. Let's begin today by thanking our sponsors, Cleveland Clinic Mercy Hospital and Studio Arts and Glass, and of course, our socially distant technical producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our very special guest, Maria Griffin, nurse practitioner at Cleveland Clinic Mercy Hospital. Good morning, Maria, and welcome to the show.
Morning. Thanks for having me.
May is National Stroke Awareness Month. Let's begin by sharing some facts and statistics about strokes. The facts. Strokes can happen to anyone at any age. 80% of all strokes are preventable. Stroke is the fifth leading cause of death in the U.S. and a leading cause of severe disability. On average, one person dies from a stroke every 4 minutes. More than 795,000 people have a stroke each year in the U.S. Stroke kills almost 130,000 out of 800,000 Americans who die of cardiovascular disease each year. That's 1 out of every 19 deaths from all causes. This morning, we're going to talk with Maria Griffin, nurse practitioner, about the risk factors, prevention, symptoms, and treatment of stroke. We'd like to remind our listeners that today's program is available on our podcast. You can download that from the App Store on your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe.
So, Maria, welcome to the show. We're glad to see you. We'd like to thank you for your service as a nurse practitioner, especially during this pandemic. Please tell our listeners about yourself and your role as a nurse practitioner at Cleveland Clinic Mercy Hospital.
Well, I'm a Stark County native. I've been a nurse for almost 20 years, a nurse practitioner for 14 years now. I've been here at Mercy for the last 6.5 years. I'm a stroke certified nurse, and I also have a certification in neuroscience. I work here at Mercy as the stroke program coordinator, helping with all stroke metrics, quality, and education, not only of patients and staff.
Has your last year been sort of chaotic? Was that the right word?
It's been up and down, certainly.
Okay. So how common are strokes, and strokes something that our listeners should be concerned about today?
Absolutely, they should be concerned. As you indicated, there are 800,000 Americans nearly have a stroke every year. That's a huge number and certainly a reason to be proactive about your health.
So let's start with the basics. Tell us what a stroke is.
So there's different types of stroke. There are ischemic strokes where a blood vessel gets blocked by clot or plaque, or a hemorrhagic stroke where the blood vessel bursts open. With either type of stroke, your blood flow to your brain tissue is interrupted, and because of that interruption, that tissue becomes damaged and can die. And that's what a stroke is. It's an area of damaged brain tissue.
So typical symptoms of a stroke?
So the typical symptoms of a stroke come on suddenly. Sudden weakness or numbness down one side of the body, that's face, arm, leg. Sudden trouble talking, whether it's slurred speech, trouble getting words out. Sudden changes in vision, double vision, loss of vision. Sudden change in your balance or coordination, or if you get the worst headache of your life. There's a little mnemonic I like to teach my patients here, and that's B fast, each letter standing for something. The B standing for balance, the E for eyes, the F for face, the A for arms, the S for speech, and then the T to time to call 911.
What about pain? Can it be painful, like a heart attack? I mean, chest pain, that sort of thing.
It's rather unusual to have pain with a stroke. That is a very common myth. The pain can occur if you get a stroke in the thalamus, one of our sensory stations in the brain, but typically stroke is painless unless it's a hemorrhagic stroke where you have a sudden artery that ruptures and you have a lot of blood where it doesn't belong in the brain. Those patients can get a really bad headache.
Okay. What should our listeners do if they see a loved one showing one of the symptoms of a stroke?
Absolutely, call 911 immediately.
Do you think we should try to take someone who's having a stroke to the hospital ourselves?
I'd rather you not. 911 is there for a reason. Um, Additionally, I like to remind patients, please do not drive yourself to the hospital. I had
Yeah.
two patients last week that tried to do that and both damaged their car on the way in.
Geez.
If you think you're having a stroke, call 911.
Okay. So, if someone believes they're having a stroke, should they take an aspirin before seeking care?
They really should not. And there's two different reasons. I tell patients to not take aspirin. First of all, at home, there's no way to decide which type of stroke you're having. So if you're having a hemorrhagic stroke where your blood vessel has burst open and you're spilling blood where it doesn't belong, taking the aspirin can actually make that worse. But also, more than a half of patients that are suffering a stroke have some trouble swallowing. So taking
Hmm.
aspirin, they could potentially choke or take it down to their lungs. So no, if you're having a stroke, don't take aspirin.
Okay.
We will make that decision when you get here if aspirin is appropriate for you.
Okay. What are some common misconceptions you hear from patients about stroke?
Well, as Mr. White indicated, pain. A lot of people, they tell me, oh, well, I didn't go to the hospital because I wasn't having chest pain. Um,
Hmm.
and the other thing I hear in terms of misconceptions is patients tell me all the time, oh, I felt fine. That's why I didn't go to the doctor to get my yearly wellness physical. And many times those patients that don't seek, routine medical care don't realize that they have risk factors such as diabetes or high blood pressure. So everybody should see the family doctor on a routine basis just for a regular checkup to discover some of those risk factors.
So, how about what are some common risk factors for stroke?
By far the most common risk factor is high blood pressure, but diabetes, high cholesterol. Folks that have high cholesterol are more likely to develop blockages in their arteries, whether it be in the arteries around the heart, coronary artery disease, the carotid arteries in the neck, or even in the lower extremities. So those are big risk factors. One that a lot of people don't realize is sleep apnea. Untreated sleep apnea can be a risk factor for stroke. Obviously, extracurricular activities we know that are bad for us, tobacco, excessive alcohol, drug use, those are all big risk factors. And then, atrial fibrillation, we see quite commonly in elderly population, which is an irregular heartbeat that can increase the risk of clots forming in the heart and can increase the risk for stroke. Those are the most common risk factors. Of course, there's many more out there, blood clotting disorders and stuff like that, but those are the biggies.
So, of all the risk factors, what would you suggest we focus on? I mean, I can't think we can do them all, but we can certainly quit smoking and all that other stuff. So, it's associated with that, like um, some of the mimicking things that mimic smoking.
Mm-hmm. Well, it's hard to pick just one risk factor to work on there. If I get a choice, I'm going to pick two just to answer that question. I totally agree with you. Smoking, especially in our younger population, everybody knows smoking can lead to, lung cancer and lung disease, but they really don't realize, I think, sometimes the impact it has on our arteries. And smoking can really increase the risk for stroke. I can't think of the last time I saw somebody under the age of 45 that had a stroke that wasn't a smoker. So certainly smoking, but then high blood pressure. High blood pressure is the most common risk factor for either type of stroke. Folks, if you have high blood pressure, make sure you're checking it regularly. Make sure you're taking your medication as prescribed and reporting your numbers and your concerns to your family doctor.
It is overwhelming the number of people who still smoke. Not to mention the fact that the cigarettes cost so much money,
Yeah.
but the other thing is that everybody knows that they're bad for them. Okay, I mean it's everywhere. Okay, in the 50s, they used to have doctors, phony doctors, mimicking doctors and saying, well, my patients, I suggest they smoke Kent with the micronite filters. I remember that commercial, and I'm thinking, holy smokes, what is going on here? So, but I don't see those commercials any longer on either.
Thankfully.
So fortunately. So, um, how about the current environment um, with a few more stroke victims? Not very many coming in because of um, COVID-19. I think they've made such a huge fuss out of this, and it's been like no, so few people, I guess.
This last year has certainly been interesting with COVID. You know, a year ago at this time, we saw a decreased number of strokes presenting here to the hospital. But my neurologist here in town kept telling me they were having them come to their office. So what was happening is patients were afraid and reluctant to seek care in the hospital for fear of getting COVID. So they weren't seeking immediate medical attention. They were seeing their family doctor, you know, in a delayed fashion, and then having an appointment with a neurologist as an outpatient, when certainly, you know, the most appropriate thing would be is to come to the hospital if you're having a stroke. That does seem to have gotten a little bit better with time. You know, we do know that coronavirus can increase the risk of clot formation in the body. I've seen a couple young, healthy patients with COVID who that was really the only risk factor that we could find despite a thorough workup for stroke. With now that the vaccines are being rolled out, it seems like people are back seeking care. Our overall numbers for the first quarter were pretty much the same as they were for years past. I've not seen an increase in number of overall stroke cases from coronavirus or the vaccines. I know there was recently a lot of concern with a couple of the vaccines in regards to causing clots in the veins of the brain, which could increase the risk for stroke. I have not seen any of the cerebral venous thrombosis that the media was concerned. We've not seen any strokes related to that here at Cleveland Clinic Mercy.
Well, what about the sedentary? I mean, so many people I've talked to, they're afraid to even leave their house, and they're sitting around watching television all this time. So, and whatever they're doing, I don't know, but has that increased strokes?
It's hard for me to say because unfortunately, we have a huge population that's sedentary long before COVID. Being active is so critically important to our health. But I imagine you could probably comment a little bit better than I. I know here in the hospital, I've seen a lot of strokes over the past year due to non-compliance with medications. People stop taking their medications because they're not going to their family doctor to get the renewals. Have you seen a decrease in people filling their scripts?
Very interesting. Well, you know what? It's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing stroke awareness with Maria Griffin from Cleveland Clinic Mercy Hospital.
Okay, before the break, Maria asked us if we had seen a rise in patients that have not been taking their medications regularly over the pandemic. And for the most part, our patients on maintenance medications have been pretty good. One of the services that we offer at the pharmacy is we assign a health coach to each patient that has heart disease or diabetes or a chronic condition like that. And we try to give them a call once a month and make sure that they have what they need. If they need help getting refills, we could try to call the doctor. So I think our patients on chronic conditions have been very compliant and done a great job in trying to navigate the unique office visit environment. However, I do believe wholeheartedly that patients that need to seek care for that initial instance have delayed doing that at times. And like you said, until there's a bigger hole in the dam, nobody wants to admit they need to go to the doctor. So So that's always an interesting experience. But if you need someone to help you keep track of all your medications, we can do that at the Medicine Center. It's something that we've offered for the last couple of years, and it's been very popular and very well received to help keep track, especially if you're taking multiple medications. So let's talk about different populations and their risk. We know that African Americans have a higher risk of heart disease. Do they also have a higher risk of stroke?
Yes, African Americans are more likely to develop high blood pressure, also known as hypertension, at a younger age. It's often more difficult to treat, and they're more likely to have other comorbidities like diabetes. So yes, they are more likely to have stroke.
Okay. Do we know why? Is it just the comorbidities?
It's genetic makeup, but some of it also is cultural. Certain ethnic groups are more likely to consume fatty fried foods, for example. So that does increase the risk.
Okay. What about prevention? We hear a lot about heart disease prevention. What about stroke prevention? What can we do?
One of the biggest things that you can do to prevent stroke is just get your regular primary care doctor checkups. Make a partnership with your doctor to discuss your health. If you have chronic medical conditions like diabetes, high blood pressure, and cholesterol, work to control them, not only with medications, but also lifestyle changes. That good old fashioned diet, exercise goes a really long way. Um, Take the medications as prescribed. And of course, if you are doing things we all know that are bad for us, smoking, drinking excessively, using drugs, knock it off. Those are not in your benefit by any means. And I always like to tell patients, because once again, a lot of people don't realize sleep apnea is a risk factor for stroke. If you have sleep apnea, treat it, get it treated.
That's the sleep apnea is really interesting to me. Can you expand on the reasoning, do you think, or what your opinion is as to why that's a risk?
Well, with sleep apnea, people don't oxygenate, breathe normally during sleep. There could be, it can make your blood pressure higher, make it more difficult to treat, but also when folks have sleep apnea, because of those alterations in blood pressure, the heart has to work harder. It can also cause folks to develop irregular heartbeats like atrial fibrillation. So all of that combined can increase the risk of stroke.
Well, we know getting a good night's sleep is important, and I just think it's very interesting that having a sleep apnea condition is actually even worse than as far as your cardiovascular health. So that's really interesting. What is a TIA?
TIA stands for transient ischemic attack. It's a fancy way of saying a mini stroke. With a TIA, folks get stroke symptoms, which we already discussed, that sudden trouble with weakness, numbness, vision, abnormalities, balance, coordination. But the symptoms are typically brief. The textbook says that they can last up to 24 hours. Clinically in practice, usually they last less than 1 hour. But with a TIA, there's no lasting damage to the brain. But it's equally important, if you have a TIA, you should seek immediate medical attention.
Okay. So, any other important signs of a TIA that we need to be aware of so that we get attention immediately?
Your listeners know what's normal for them. If they suddenly have some neurologic symptom come on, or if they go to bed fine and they wake up with any of those stroke symptoms, it's certainly a reason to seek medical attention.
Okay. I think it's about time for the news.
Okay, folks, it's the bottom of the hour. Time for the news. You're listening to Health Matters with the Medicine Center Pharmacy. Just a quick reminder that Janssen's COVID vaccine is available for immunization at all our Medicine Center pharmacies. So we have a lot more to cover about strokes this morning. Let's get back to the show.
Okay, before the break, we were talking about TIAs and some of those signs and symptoms. What are the current acute treatment options for a stroke?
So the whole reason we want folks to come to the hospital immediately for a stroke is because some of the acute treatments are time dependent. For example, IV alteplase, also known as TPA, it's a very powerful clot buster drug that we give through an IV, but it can only be given in the first few hours of a stroke. So that's really the biggest reason to come to the hospital immediately to see if you're possibly a candidate for that medication. It can only be given out to 4.5 hours from the time that the person was last known to be well or perfectly normal. And for that reason, whenever folks come to the hospital, that's why you're going to get beat up with questions. When was the last time you were totally normal? So please note that time or the time of onset of symptoms. Heaven forbid you or a loved one ever has a stroke. But there is also another procedure called a thrombectomy. This is something for strokes in the large blood vessels of the brain. These are your more severe strokes. They can do a thrombectomy out to 24 hours from the time the patient was last known to be normal. And what a thrombectomy is, if you have a clot blocking one of the major arteries of the brain, they go in similar to a heart cath. A special doctor, this takes a very specialized physician, a neurointensivist or neurointerventionalist, or in some hospitals, a interventional radiologist can do this procedure where they go in, they snake all the way up to the brain, and then they remove the clot or thrombus. I know I make it sound very easy. It's certainly not by any stretch of the imagination. But the patients that undergo these types of procedures, like a thrombectomy or IV alteplase, they do better than those that don't. Unfortunately, of course, not every patient is a candidate for these therapies. Folks that have a hemorrhagic stroke where one of the blood vessels bursts open obviously aren't going to be a candidate for a powerful blood thinner. That'll just make them worse. So once again, I really encourage folks, if you think you're having a stroke or you think your loved one is having a stroke, call 911, come to the hospital immediately.
So,
Well,
go ahead. I'm sorry.
Go ahead. No, go ahead.
Okay. So, someone is hospitalized for a stroke. Okay. What kinds of tests are typically completed?
Well, in the emergency room, upon arrival, we do a CAT scan of the brain. And the CAT scan is more to rule out a hemorrhage or abnormal bleeding in the brain. It's not the greatest test to look for an ischemic stroke or one of the blood vessels gets blocked, but certainly ruling out that hemorrhage is crucially important. After folks are admitted, we typically will do an MRI scan of the brain, which gives much more detailed pictures of the brain. In addition to imaging, we're checking your blood studies. We're looking to see if you're anemic, you have an infection, looking at your kidney function, different things that play a role in your stroke treatment. We're checking your diabetes numbers. Are you well controlled? Or do you have diabetes and maybe you weren't aware of it? Checking cholesterol numbers, monitoring the blood pressure frequently. One of the things whenever you're admitted to the hospital for a suspected stroke, we put you on a heart monitor and we watch the electrical activity of your heart for a prolonged period of time. And sometimes we're not able to see any abnormalities in that, but we're suspicious. Maybe you did have an irregular heartbeat. So we send you home with a heart monitor to wear for 30 days. Other tests while folks are admitted to the hospital, we do ultrasounds of the heart to look for trouble with the way the heart pumps or trouble with the way the heart valves open and close. We look to see, do you perhaps have a hole in your heart, maybe that you were born with that is contributing possibly to a stroke. And then one of the other things that we really look at carefully is the blood vessels, your pipes, if you will. Looking to see, do you have any blockages in your carotid arteries that supply blood flow to the brain? And in some instances, we have to look at the arteries in the brain, the major ones, to look to see, do you have any narrowing and those arteries plaque filled up, or do you have a clot in one of those big arteries? So there's a lot of different tests that we do when folks are admitted. And that's of course tailored to the patient. Um, if you have a young person who's, 35, 40 years old with a stroke, we might be also checking for inherited clotting disorders, things that maybe would increase their risk for developing clots. Tend not to look for inherited clotting disorders in a 95-year-old patient who's made it that far in life without developing clots, but it gets tailored to the patient and what risk factors they have.
Okay, I guess it's time for another break. You're listening to Health Matters with the Medicine Center Pharmacy. What about the Rehabilitation Center? Um, do they offer treatment for stroke victims?
Yeah, we have a great rehab center. Not only do we have an inpatient rehab center here at the main hospital that is able to take care of our stroke patients and help them on their road to recovery, we also have outpatient therapy services and home care therapy services. But our therapy services include physical therapy, occupational therapy, speech therapy. They are crucial at helping folks regain their mobility, helping with safety awareness, and then cognitive therapy, because unfortunately some strokes do have a lot of cognitive issues afterwards. And Mercy also offers a driver rehab program to make sure that after a stroke or after other neurologic illnesses or other medical ailments, just to make sure that that driver is safe and mentally capable of performing all that is necessary to get behind the wheel of a car. So yeah, the driver rehab program is part of our therapy services as well, and we have a great group of therapists.
Now, are you involved in the therapy?
I am only on the inpatient side, so no, I'm not a therapist,
Okay.
but I certainly write orders for therapy all day long just to make sure that our patients do get the care that they need.
Okay, so you're kind of the director of the therapy or not?
No, no, no. The director of
Okay.
therapy is a physical therapist, not me.
Okay. No, I guess I'm thinking the schedule of all the things that they have to do to, from physical therapy to on and on.
Mhm.
That I would think that someone has to be an overall scheduler and all that sort of thing. So guess I'm wrong, huh? Okay. Um, what about stroke support? Does Cleveland Clinic Mercy Hospital offer support after you're out of the hospital, or do they follow you, or how do we handle all this?
There are two local stroke support groups. There's one that meets in the North Canton area at one of the local churches. They just changed locations actually. And then we have another stroke support group down in Tusk County. Uh, both of those stroke support groups are wonderful and have a good following. During times of COVID, of course, they do meet with social distance, hand washing, masks, and stuff like that. But they're crucial not only for our patients, but certainly for their caregivers. When you are suddenly a caregiver, and that's not something you've ever been accustomed to, that caregiver needs support as well. Just the caregiver support group just helps to offer solutions and tips from other people that have been there. But we do have information on our website about the stroke support groups for anybody that's interested.
What about um, a stroke victim? Is it common that they repeat somewhere down the road, or uncommon?
Do you mean that are you asking if it's common if they have another
Yeah,
stroke?
or more a series of strokes, I guess.
Once you've had a stroke, you are at increased risk for more strokes. That's why we bring you into the hospital and do all the testing to see if we can identify the cause of your stroke. So that way we can help to reduce your risk of another stroke. Certainly, if you're admitted to the hospital and we find that maybe you have a bad carotid stenosis or a narrowing in the carotid artery here in the neck, which restricts blood flow to the brain, that would require possibly surgery, but medications to prevent clots from forming in that area, blood thinners, and would require cholesterol medications to prevent it from getting worse. So That's certainly important. If we find you have an irregular heartbeat, we would want to treat that with powerful blood thinners to prevent stroke. But unfortunately, yes, after you have a stroke, you are at increased risk for more. And that's why it's so crucially important to be evaluated so that we can work on your risk factors to prevent you from having another one. Do many people have one stroke and never have another one? Yes, indeed. Do some people have multiple strokes? Unfortunately, yes.
I missed this question in the beginning. When brought into the hospital with a stroke, do you administer some kind of medication immediately, or do you put the individual through a battery of tests before you administer any clot dissolving meds?
Well, we have to do a CAT scan of the brain before we administer any blood thinners, just to rule out a hemorrhage. But as I said before, not everybody is a candidate for that powerful blood thinner alteplase. There's another medication that is well researched and is not yet approved, FDA approved for stroke, but I expect that in the coming years it probably will be, called tenecteplase. That'll be a great thing. It seems to work a little bit faster and more effectively than our current treatment. And also on the nursing side, it's much easier for the nurses to administer, and it has less risk of hemorrhage. So there are new things always coming up with stroke, and that's one that I'm personally very excited for.
What about the ambulance individuals? Isn't there typically a driver and a care person with the patient when it comes in to the hospital? Are they good at, I guess, diagnosing a stroke, or do they just show up and say, "Hey, here's somebody, there's something wrong"?
Now, our local EMS providers are certainly awesome. And one of the things that our local EMS providers do, if they believe they have somebody that has suffered a stroke, they call the emergency room ahead of time. And if it's somebody that is within that time window that may potentially receive that powerful clot buster, our local EMS providers tell us that, so that way we can get our stroke team ready and clear that CAT scan, so that way that patient has priority for the CAT scan machine. No, but our local EMS providers, they have been extensively trained in stroke and have stroke protocols that they follow themselves.
Interesting.
Okay, Maria, how about one more time we review with our listeners what to do if someone thinks someone is having a stroke?
Be fast and call 911. And remember that be fast is helping to help you remember the symptoms of stroke: sudden trouble with balance, sudden changes with your eyes, double vision, loss of vision, sudden weakness of the face, arms, or sudden weakness or numbness, sudden changes in speech. And that T is time to call 911.
The sooner the better.
Amen.
So how about you list your contact information if patients want to get more information about stroke, or the Mercy website, which we'll link also in our program so people can go right to that spot. But please share your contact info.
So the website, the Mercy website, has the information not only for our stroke support groups, the stroke center, and the office number here. It's www.cantonmercy.org/stroke.
Very good. Do you have, we've got about 5 minutes left. So any, you want to give a summary of anything that is your most important message that you can tell a patient that is going to have to deal with a situation like this someday? We're all busy. We're all like distracted, and I know that a lot of us tend to feel like, I don't feel quite right, but I'll wait a little bit. It'll be okay. So maybe addressing kind of those kind of concerns.
If you've got sudden neurologic symptoms or even sudden chest pain, for example, don't wait. So many patients will tell me, "Oh, I just took a nap because I thought if I went to sleep, it would just I could sleep it off."
Oh,
Or the other thing that I hear from patients is, Whenever, because like I said, stroke can occur during sleep, and they'll wake up and maybe they can't move an arm or a leg, or they're, numb on one side of the body, and they'll tell me, oh, I just slept funny. And I often say to them, well, when you've slept before, and your hand's in a funny position and it's numb, that typically lasts a couple seconds after awakening. And I'll ask them, have you ever woken up before and your face was numb? And they're like, well, no.
Yes.
So, or have you ever slept funny? You couldn't move a whole side of your body? Like, well, no. So certainly, it's normal for you. Seek medical attention. But then the one thing I'd like to just make sure that I say is, if you know if you've learned anything from this program, or you've learned about the symptoms of stroke, don't keep it to yourself. Tell your family, tell your coworkers, talk to your friends. It's Stroke Awareness Month, so not only are we trying to educate your listeners, but we're hoping that they'll share that information with somebody. You never know when they may be the victim, and that loved one that they share that information with would be the one to help get them that immediate help. So don't keep the information to yourself.
Interesting.
Very good. Well, great info.
Is there an average age of stroke victims?
So certainly the older you get, the more likely you are to have a stroke. But unfortunately, we've seen strokes here this year, folks down in their 20s, all the way up to, I think my oldest this year was 99 so far. So the whole gamut of ages. Certainly when you're in your 60s, 70s, the numbers exponentially get higher, but we can see stroke at any age.
Amazing. Well, Maria, thank you very much for coming into our program today and spending time with us. We learned a lot. Maria Griffin, nurse practitioner at Cleveland Clinic Mercy Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital and Studio Arts and Glass, and of course, our technical producer, JD DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you right here on News Talk 1480 WHBC next Friday.